Good afternoon, everyone, and welcome to the webinar hosted by the Alliance for Equity in Cancer Care and the Massey Cancer Center. I am Jennifer Cullen. I am from Case Western Reserve University, as well as the Case Comprehensive Cancer Center, where I serve as a professor in the School of Medicine, as well as the Associate Director for Cancer Population Sciences. And I welcome you today to this webinar to discuss the very important topic of data sharing agreement across the funded Alliance sites, of which Case Western is one. And I'm going to now turn it over to Dr. Roy Sabo, who will lead this discussion. Thank you so much.
Great. Thank you very much, Jennifer. Hello, everyone. Welcome to our discussion of data sharing agreements. Just by way of introduction, I'm Roy Sabo. I am the past director of the Biostatistics Shared Resource here at Massey Cancer Center at Virginia Commonwealth University. I am currently director of a similar unit for our translational research group, also here at VCU. A lot of what we're going to talk today is based on experiences learned the hard way, both good and bad. So basically, we don't want the same mistakes to be done here in the Alliance, and we want to make sure that all of the good things we learned in the past are done here. Next slide, please. So to give you a high level of what we're going to talk about, I'll give a little bit of description about what the data sharing agreement is. I don't want to spend too much time because on the face of it, they're rather simple documents in terms of what they usually consist of. What we want to focus on is what it should consist of and how you can really get more bang out of your buck in spending time up front making it. So again, we'll talk about its goals and purposes, a little bit about standard content, but I want to spend more time in the last two bullets, talking about lessons we've learned in the past and very specific guidance about what we can do here in the Alliance to make this a better process. And then also open up the floor for questions, because I'm sure we have some. Next slide, please. So in order to understand the data sharing agreement, it helps to back up a second and think of the data use agreement. Data use agreements are traditionally one-way relationships where one party who holds the data is handing it or a part of it over to someone else who would like to use it. Typically these data use agreements they're basically the do's and don'ts. Like, you cannot do this with the data. Like, you can't link it with an external source. You can only publish under these permissions. So there's usually a lot of limitations on use. There's also usually specifications on how the data can be managed or stored. And again, the idea is this is a one-way relationship. The end user is being told what they can and can't do. Data sharing agreements are different because they're usually organically created by a group of individuals who are sharing data, or who are, like in the Alliance, sharing data with one place or with a central location, a coordinating center, if you will. So the DSA borrows some of the same ideas from the data use agreement. It just usually requires much more specificity because the relationships between the users are usually much more complicated. For instance, in a lot of the consortiums we've done in the past, like the Alliance, there are effectively 8 separate research projects, all related on the same topic or disease or condition, who've made some pre-arrangement to share combined data. Whether that's during or after, it depends on the project, but that's usually the idea. So how the data sharing agreement is what helps us coordinate those activities. Again, the limitations to use or the obligations in terms of what we're going to share, they usually need to be much more detailed because there has to be more coordination up front so that we can all be sure we're getting the same thing and putting it in the same place at the end. Since it's more of a circular relationship more than the one-way street, the details have to be much more clear. Also, the users and the providers tend to be the same people. It's not just an end user who's hoping to make use of the data that we have. These are our colleagues, our peers. And oftentimes in a network such as the Alliance, that's still part of the Alliance. It's still us. So in that sense, the nature of who's whom, who's sharing the data and with whom, needs to be clearly specified. Next slide, please. So what does the DSA attempt to do? Again, there's the bare minimum, which is probably what most of our experiences are, and this is including my own. Most DSAs are very bare-boned legal documents, but what are they trying to do, or what should they be trying to do? One goal is to stipulate who can access the data, and that's both at the site level, the alliance partner level, and at the control center or the coordinating center level. Who has access to the larger pool of this data? Why is it being shared? It helps to remind ourselves that throughout this process when we're writing the DSA, what exactly are we sharing it for? And it's not just because we're being told or because it's part of this funding mechanism. It's got to be grander than that. It has to be tied to the science. And it has to be to the particular reasons of what we're hoping to achieve with that data. Being very specific about what the consortium's ideas of the grand aggregated data set are will help making the DSA a much more productive activity. Another goal is, well, what types of data are going to become accessible? Again, at the high level, not at the site level. Is this going to be a limited data set? Is it going to be de-identified? Are there sensitive bits of information in there? If so, or if not, how are we going to ensure the patient privacy and confidentiality? What safeguards are we going to use at all levels of this process, both site storage, transmission, and at central location storage? So we have several goals. The standard content, and I'm going to rip off this a little bit to show where we can expand on this to make the DSA writing process a little bit more purposeful and helpful. Will be coming in a second. But first, we have to define the roles and the responsibilities of the different entities. So for the Alliance, that's the different partners, as well as the coordinating center here at VCU. Who are we and what's our roles, both in terms of the grant project and in terms of collecting the data and delivering the data? What data, which parts are we worried about as the separate entities, and which parts do we have to work in concert with all others? It's important to know who's whom in that sense. Next, it's important to specify which data can be shared, when it's going to be shared, and under what circumstances. This is where, again, a little bit of detail is usually included from a contractual point of view. For instance, each of the partners will share data once a year for every year of the grant project. I've also been on consortiums where we've shared the data at the very end. So we basically worked independently, and at the end, we combined all of our data. I'm not saying one of those is good or one of those is bad, but that's typically the bare minimum, the frequency of touch in terms of sharing data with the coordinating center. The planning for that data structure and the delivery, though, is usually given short shrift in the initial data sharing agreement. It's usually the when and the by whom, and if there's any details, it's oftentimes larger details, like extracts from the EHR will be shared by the partners to the consortium coordinating center on May 1st of every year. That's not usually helpful enough, and it's not enough work to make the progress as seamless as possible. It's never going to be seamless, but to make it less work, we can actually plan for the data structure, the tables, the process of delivery, and put that in the data sharing agreement up front. It's actually best practice to do that. The data sharing agreement should also enumerate the acceptable data uses and prohibitions. That goes both for the partner sites and for the consortium control center. As we will see in subsequent slides, it's actually best to limit that data going to the consortium to the bare minimum necessary to achieve the consortium's goals, or in this case, the alliance's goals. And so we should plan for that up front. And then, as always, we need to specify the safeguards for the data privacy and security. These are huge, complicated projects. Data safety and security are important for any one project. It's as important for an alliance or a consortium. It's just harder to control. So we need to have the safeguards specified up front to ensure that the PHI is safe and that we limit the possibility for any data breaches or grievances. But we also have to have the grievance process in there in case anything goes wrong. Next slide, please. All right. So these are practices that we've learned over the years, again, the hard way in some cases, in terms of definitely what doesn't work, but more importantly, what does work. If we focus on the positive here, a lot of these are framed to limit the negative at the same time. The first is to not treat the data sharing agreement as a legal document, as a compliance document. It's something you need to do to satisfy the alliance or the funder, whatever the case may be. Rather, think of this as the first step towards a grander data management plan to write papers for all alliance members. That means the following type of ideas. Which data are going to stay with alliance members? Which data go to the alliance as a whole? And it does help to actually split out what papers are the alliance going to write. If you think of it from a paper point of view, or if you think of it from, well what research output does the alliance as a whole need to produce, then you can start to limit the data pieces that need to go to it. Not that we want to limit it per se, but we want to share the minimum possible amount of data for safety and compliance reasons and for personnel and practical reasons. It takes effort to clean, share, and store data. So we want to minimize that. And it'll honestly be less work for everybody if we do so. So if we think about the data sharing agreement, one, as a compliance document, but two, as a research document, it's going to shape the rest of the conversations in terms of the data that we actually share. The next best practice that we've learned is that the time that we spend up front in planning the data management process and hard coding that into the data sharing agreement, the less time we will have messing around and trying to fix problems at the end, and the less time we will spend analyzing that data for the alliance as a whole. These are all good things. So to the extent that it's possible, it's best to finalize any data tools and elements before the DSA is completed. Often, what we have done along these lines is basically just had versions of data sharing agreements. Like maybe there's a version 1.0, which includes signatories from all the alliance sites and the high level pieces of what types of data are going to be shared. Whereas data sharing agreement version 2.0 includes appendices with very specific data tables, data tools like surveys that can also be dated, and particular data elements. Although this can also just be done up front as well, time permitting. The reason for this, and again, this is from experience, is that if you let the sites get too far down the road of conducting their own research, the likelihood that they develop their own data capture process and tools is going to prohibit recombining that at the end. So getting specific and sharing tools across those sites during this drafting process is key to the alliance's success as a total. The next bit is who's doing the data management for the alliance. Again, all of the alliance members are independent in the sense of conducting their study independently. But who's going to manage the data for the alliance as a whole? Is that going to be done locally and then we're going to share tidy or cleaned data with the alliance? Or are we sharing raw-ish and hopefully de-identified with the consortium command center, at which point they will be doing this? I have been a part of multi-center trials where we've done the latter, and that is a nightmare. because you basically have one informatics team who's trying to clean disparate data tables in the same way, even though they come from different places. So basically, you're trying to take X, Y, Z and turn it into W. Whereas with local management, you're at least getting X and Y and Z to turn it into W before you send. There's still going to be some residual amount of cleaning or managing or informatics work to be done at the Alliance headquarters anyways. But that process can really help. So to the extent that having the sites have a sending tidy data to the control center, that really helps. And to the extent that they have a common tidy data framework to work from, so like for instance, a common data dictionary or what we call a living code book, to help each of the sites create the same data tables to be shared, to simplify the informatics work at the consortium hub, that really saves everybody a lot of time. Having it done locally is typically work they're going to be doing anyways. So having that hub or spoke to hub model can really save a lot of time. But you need to spend that time up front before the data are even collected or before subjects are recruited in order to get that common understanding and that common data dictionary in the first place. Next slide, please. I also suggest a parsimonious approach. Some consortiums typically request to send all of your data, every single table, every bit of it. And sometimes that goes for quantitative as well as qualitative data like field notes or interviews or surveys or transcripts. That's okay. But there's bound to be redundant work in that case, especially since the local sites have their particular research agendas as well. So limiting the amount of data that the consortium is going to receive is actually a good thing. And if we take this back to the first recommendation, which was to think of the data sharing agreement as more than a compliance document and to think of it as a research tool, the parsimonious approach goes hand in hand with that. What's the minimum amount of data that we need from our alliance partners to answer the consortium goals? And again, if you think of in terms of what papers or white papers or policy documents does the alliance need to create, well, then if we answer that question, then we know the minimum data pieces that can go in, and thus limit it to that. That's going to reduce the amount of work for the site informatics scores, who are going to only be managing that smaller amount of data that needs to be shared in the common way. And it's also going to limit the amount of work that the informatics folks do for the alliance, since there's going to be fewer fields and tables to be working with. And hopefully those are in the tidy format. It'll just be less work all around. And they'll be able to focus more on just those papers. The parsimonious approach tied into the research-based DSA format is also going to reduce the amount of downstream battles over who's writing what. Having that understanding up front is going to make, oh, the alliance is writing this paper, the alliance members are free to write these papers. Having those discussions up front, again, makes most parsimonious use of our time, because then we're not battling things out at the end when time is tight and tempers are higher. The parsimonious approach is also, although not least consequentially, is also very beneficial in the sense of minimizing the PHI that's shared. Even with the best intentions and approaches to de-identify data and to minimize the amount of PHI, there's always room for shenanigans to happen. Minimizing what is shared in the central location is going to protect everybody. The sites who've shared the data on behalf of their patients, and with respect to the alliance handling sensitive data on their own and running the risk of making a mistake that we can't recover from. So again, just taking that parsimonious approach is best for all involved. The last bit of best practice or advice that I can offer is to engage a broad variety of stakeholders in drafting the data sharing agreement. as possible. And that includes anybody. So sometimes, the informatics core is the last group to see the DSA. It's written by PIs or project coordinators. The informaticists, the biostatisticians, anybody who's going to touch the data at some point, whether early, during, or after, and that goes for the people who are collecting the data too. They all need to see and participate in drafting this document before it gets too far down the road. Informaticists know a lot about what data are going to be available, what it's going to look like, and what they can do with it, what's possible from it. Biostatisticians know the research questions. They know what data are needed. Those two types of individuals need to be in the room at the same time, seeing this type, having these conversations with the PIs. Those individuals who are collecting the data, they know how feasible it is to get the data that is going to be shared. So if if the Alliance is going to be backing or staking a large part of the project on a particular set of data that the team knows is going to be really hard to capture, maybe we need to rethink things. We need to invite the people who know those types of lessons to this initial part, step 0 of the data capture process, so that this agreement is made with everybody knowing the same thing. But honestly, the DSA process should include more than just those people who touch the data. It should include those who are going to use the results, those who are waiting for the results to occur. This can be policymakers. This can be funding agencies, those who are, who are trusting us to find the answers to these broader research questions. And it can be, community researchers, community stakeholders, our partners out in the community who aren't researchers per se, but the type of people who we conduct this research for, those who are going to immediately take it and turn it into something translatable and actionable. Getting their input on what this data is going to be shared for, to look at how the Alliance is going to take this shared data and turn it into something, their input is going to be valuable. And they can spot the holes of what is the Alliance not getting, or what are they not going to be able to do based on the current plan. Getting them before we sign off is key. Next slide. So those are the 30,000-foot view of the DSA, and the big lessons that I wanted to share as we're about to start this process of crafting our own data sharing agreement for the Alliance. So at this point, I would like to open it up to questions for all of our members. I believe you can put these into the chat. I will read and repeat. I do have some questions up there to spur some discussion, but please, anything that's on your mind is going to make the best use of this time.
Dr. Sabo, my apologies. I was trying to unmute myself. I do see one question in the chat space as we wait for other participants to add questions. One question is, in your past projects, what were some of the circumstances and/or rules regarding sharing data and/or insights with expanded partners like stakeholder community and student workers?
Oh, that's wonderful. I will honestly say that the DSAs we didn't get that far in terms of students, although that is the exact type of specification in terms of roles and entities and potential use that should go in. If you would like for the data either at a site or from the Alliance to be a training tool, or to be something that could be used in a master's thesis or a doctoral dissertation, that's great. You just got to let it be known that that's possible, and what are the specifications and limitations. Who can help, or what will be available to them. So while it's not from a consortium project, we do have several repository kind of data sets where we have this exact kind of thing. And usually for students in learning, we say that this is applicable provided that the advisor is either an alliance member or like Reliance adjacent. So for instance, like maybe an alliance PI is a committee member on a dissertation committee, then that's permissible. But someone's got to represent the alliance in that relationship. We also typically don't pay. Again, different alliances have different consortiums have different specifications on how they share the data at the end. Some charge, some don't. For those that charge, and I'm a part of some of those, typically we don't charge learners. But we also don't make available to them the entire data set. We give them what are called limited data sets, because we don't want bastardized versions of the data set to just be around floating. And it's not that students are going to do crazy things, but they're more transient in their relationship with our partners. And so they're in and out much more quickly than we hope this data is going to be. So we typically share smaller chunks. I hope that answers your question.
It's an excellent question, and thank you. That was an excellent answer. I'm going to pose a question because I don't see any others in the chat space yet. So Dr. Sabo, in the partners consortium that I'm overseeing here in Cleveland, we have the complexity of working with a couple of community partners as well as a academic hospital and then an academic university. And we're trying to initiate a DUA, a single DUA that all sites would buy into and accept. And in having early conversations with our institution, with Case Western, I just had early concerns. What if the community partners have hesitation to having data shared? What are some good pieces of advice or nuggets of wisdom in having those conversations with full transparency and disclosure, but also alleviating concerns that might arise?
Oh, this is a fantastic question. So we deal with this at VCU too, and sometimes the biggest threats to the agreement actually aren't external. Sometimes they're internal. Sometimes they're health system based. But yes, my advice is to hear them. You need to listen to those community and external partners. They're ultimately the types of groups, or they're representing the types of people who are going to be using this data, or who are going to be in need of the results from it. The best we can do is listen to them. And to the extent that it's possible, we can start to take actions that address some of those concerns. I will say that there are some concerns, and we deal with this here in Richmond, Virginia, a lot. Some concerns are unbridgeable. And in that case, you don't necessarily want an intransigent partner to hold up the entire process. But something needs to be done. So for instance, there's cases where trust is irrevocably broken. How are you going to fix that? Well, if it can't be fixed, what are we going to do? In those particular circumstances, we still try to bring those partners in, and we still try to hear them. This isn't necessarily in my field, which is biostatistics, but on the informatics side, this is definitely something that is actionable. What protections are going to be used to make sure that my information don't get out? In some of those cases, we honestly invite them in and we sit them down in front of the machine and we show them, for instance, something like date shifting, showing them how we're taking your birthday or your date of birth and the event of some a condition like a diagnosis. And we're showing how we're keeping that information valid, but it's no longer you, how that's not brought back to you. We show them how if information is going to be geospatially represented, we show them the details of our map. Like this is how we're going to the county level or the zip code level. and try to get a feel of, well, where's their uncomfort coming from? We show them how we would censor areas that have too little counts. And so again, just to try to give that impression of what we're doing to be safe. If it takes that type of sit down and show them, then that's something that's good to do.
That's a great suggestion. And again, I still don't see any questions coming in, so I'm going to selfishly ask one more. In this climate that the National Institutes of Health, and specifically the National Cancer Institute, has put forward, that we should be always sharing data, we should be making data sets publicly available. I wonder how we strike a balance between being parsimonious, requiring as little PHI, if no PHI at all, and as few data elements, the minimum data set that we can live with together across the Alliance, and also being mindful that the NCI wants us to put our data sets out there into the public domain. How do you manage that balance? What would be your nuggets of wisdom on that topic?
Yeah, there's no good answer for this, but it's again a fantastic question. My understanding is minimum sufficient adherence to the policy is what is the data set you used to conduct that analysis, which is an analysis set is what we call an analysis. It's much closer to the end of the line than it is the beginning. That's usually satisfactory, again, almost from a legal point of view. It's not necessarily in adherence with the spirit of the law. I can only answer this question personally, although I can give other points of views that I don't necessarily agree with. I am not in favor of sharing raw data. I am not in favor of sharing de-identified raw data. I am closer, though, to sharing something that's less than an analysis set that is yet de-identified. For instance, maybe a set that hasn't made its exclusions yet. But even though there's some who are more conservative than I am in that sense, that if you share any data beyond that which you purely statistical analyze, you're putting those individuals at risk, and they're correct, even if it's de-identified. I am in favor of sharing data, but that doesn't mean sharing it without limits. Some of the safeguards that we put into place are not unlike what the Alliance will do. For instance, there might be a publicly free and easily available version of the data that you don't need to ask permission for. That is going to be the cleanest, safest, but most general data that we can make. Purely unde-identifiable. Probably not even at the patient level. There might be a level of peer review to get a more detailed set of data. Something that, like, if, for instance, in one of the groups that I work with, we'll give aggregations, like patient level, area level aggregations for free. It's on the web. You don't even need to ask us. But if you want patient level data, you have to go through a round of review. That includes basically something that would mimic an NIH study session, where what are your goals? If they're not clear, we're not sharing the data. If you're just asking for what would amount to a large portion of our raw data, we're going to say no. You can't have that open-ended. And even if we do, then you got to believe there's going to be a data use agreement attached to it, not a data sharing agreement, but a data use agreement where you're clearly specifying what you're using the data for, what papers you're going to write or attempt to publish, and would also specify at what point you destroy the data that you received from us. This is not something that you would share as a legacy data set with others. So we have very, very clear guidance on how we're going to share it. And there's not a national standard, there's definitely not an international standard. Even NIH is getting a little bit more specific, but they're leaning in that kind of line where you need to share the data, or you at least need to have the plan to share the data. And we think that that type of nuanced approach is probably the most likely scenario for any future guidance that's created.
That is incredibly thorough and helpful. Thank you, Dr. Sabo. I just want to point out two quick things. A link was added to the slide deck at the bottom of this discussion slide. It is also in the chat in the Q&A space, though I don't know if participants can see it. So we'll make sure it's distributed. It was something Grace Hummel shared. It's a link to a very valuable handbook on using administrative data for research and evidence-based policy. And then one of the participants also asks if these slides can be made available at some point. I'm hoping the answer is yes.
I have no problem sharing these slides, so
Okay.
please, by all means.
Excellent. And then we do have one final question in the chat space. Dr. Wright asks, how do we create safe outputs from researchers' findings before those findings finally make their way into the public through, for example, policy briefs or the academic literature?
I'm not sure I understand.
Safe outputs. Maybe I read it too quickly. Or maybe Marcy can clarify her question. I wonder if it's, there she is.
Yeah, so this is a question that we often get because we have some folks that worry about publications coming out of the data before they're ready to publish their data, for example, right? So maybe somebody wants to write a policy brief, or they want to write something that kind of narrows up what's within the data, but independently, the sites are not quite ready for that data to be reported. So how do we put those safe boundaries in so that, or what have you done in the past, I guess is the best question, to ensure that these findings are not, made available prior to the team wanting it to be dispersed?
Wonderful question. This is one of those lessons that we did learn the hard way, and it's not one of the common features of most DSAs that you'll see, but this goes back to making the DSA a research document. Knowing who's doing what in terms of output, both research output, policy output, that can be specified, at least in general terms, up front. And not only can you say who's going to do what, you can say at what time are they going to do that. That makes it a perfect opportunity for the alliance partners to voice their concerns up front. Say, hey, you said in year 3, you're going to open policy briefs. What if we're not done? What happens if we're not done with our data at that time? That could hopefully be hammered out up front. What I would also suggest, and I think I mentioned this in the slides, in terms of keeping this a living document. I mean, again, it needs to be signed, so it has to be updated into new version numbers, just like a protocol would. But these new problems, as they come up, one of the best ways to head those off is to have a grievance policy, so that if a disagreement comes up, or if one of these sites makes, here's when that I heard there's a policy paper coming out, we're not even done, we're not finished. Whether they're being scooped or whether they have other legitimate concerns, have that grievance process in there for someone to say, pause for a second. Under what conditions is that permitted? And what happens with a legitimate grievance is submitted? That would be the best way I could think of to help in those kind of cases.
Thank you, Dr. Sabo. I think we're done with questions, and I don't see any more. I'm just double checking. This has been incredibly helpful, and I hope that everyone that participated today feels the same way, and we can make the slides available after today's webinar. But again, just thank you. This was a wealth of information as we get started in this process.
Well, I look forward to it, everybody. Best of luck, and please let me know if you have questions.
Thank you.
Bye.
Bye-bye.